Medication can be an important part of treatment for any physical condition, including mental health. But for a variety of reasons, Roberto isn't comfortable with psychotropic medications, those that are used to treat mental health symptoms. He is uncertain about wanting his newly diagnosed son taking them. He has a lot of questions he would like to ask a doctor. Like Roberto, many of us feel hesitant to talk to doctors, worried that we shouldn't second-guess them or that we may make them angry. It's okay to question clinicians about all therapy choices, including medications. It is not disrespectful to ask a doctor questions. We may not have attended medical school, but our care, concern, and close interactions with our loved one offers valuable insight to their recovery. Dr. Carley begins by explaining to Roberto that almost all psychotropic medications work initially right at the synapse of the neuron. She hands him an illustration that shows the synapse is a microscopic gap between neurons. Neurotransmitters stored in the axon terminal travel to a nearby dendrite and create a chemical bridge so that electronic messages can travel across the gap. The type and quantity of neurotransmitters present in the synapse impacts the way messages are sent and received, and the way the messages are sent and received influences how a person thinks, feels, and behaves. Medications change the process so that either more or less of a particular neurotransmitter is available in the synapse for the message transmission. Noticing a confused expression on Roberto's face, the doctor explains this another way. Think of shapes, which represent the neurotransmitters, as cars. Imagine that the cars are driving from one store to another, and they need to park in a parking space when they get there. The cars are leaving the first store at the axon and trying to park in a space on the dendrite. The medications can keep the cars from parking in one of three ways. They can block the entrance to the parking space. They can block the entrance back into the first axon and prevent reuptake. Or they can destroy the car and keep it from going anywhere. Scientists have learned that changing the amount of neurotransmitters in the synapse starts a series of chemical events that happen inside the cell body and nucleus of the receiving neuron. These chemical processes eventually produce significant changes in the way the sending and receiving neurons function. This may explain why psychotropic medications need to be taken for several weeks to feel the full effects. Roberto is beginning to understand how psychotropic medications work. He explains to the doctor that he has heard stories of people who need to try several different medications before finding the one that works for them. Isn't there a way to know whether a medication will work or not from the beginning? Dr. Carley explains that everyone is different, and currently there isn't a simple test to determine what the specific chemical difficulty is. Which medication is prescribed depends on what the chemical issue is for each individual based on their specific neurotransmitter makeup. That's why doctors often must prescribe several different medications before the one that works best for each unique person is found. Medications may work great for one person and not at all for another, even if both have the same diagnosis. It is difficult to predict exactly who will respond to what medication. Doctors usually review a person's symptoms and their treatment history to see if there is an evidence base for recommending one type of medicine over another. Family history, ethnicity, other health conditions, and side effects are also taken into consideration when prescribing medication. A number of large-scale research studies have determined first-line and second-line medications based on which medicines offer the best symptom relief with the fewest side effects. Most of the more common mental health conditions now have treatment protocols that are being continually refined based on new studies. Unfortunately, many research studies on medications and other treatment strategies have failed to include adequate representation from racially and ethnically diverse communities. We know that not all medications work the same way for all populations. Roberto mentions that he is most worried about side effects. He has seen those commercials that promise they can lift your symptoms, but then list lots of side effects you'll have to live with for the rest of your life. Some side effects seem as bad as living with one arm tied behind your back while walking on a bed of nails. Why are there so many side effects, and can anything be done about them? Dr. Carley explains that it would be wonderful if psychotropic medications were miracle cures. That is, the main effect of the drug was confined to a single, specific brain area and targeted only those neurotransmitters which control the symptomatic problem. But unhappily, this is not the case. These medications are more like buckshot. They hit the target and everything else around it. They block other neurotransmitters and they impact many parts of the brain which control vital body functions. In some cases, cells outside of the brain use the same neurotransmitters to transmit signals, so these medications also directly affect other parts of the body. For one example, the digestive system also uses serotonin to communicate between cells. This is why antidepressants that alter serotonin levels can also cause nausea or diarrhea. Just like with any other medication, everyone considering using psychotropic medications faces a cost-benefit dilemma, which can be stated as follows. Are the potential adverse effects of a drug, that's the cost, worth tolerating to gain the symptom relief the drug provides? That's the benefit. Research is revealing some promising new solutions that will be more targeted and have less side effects. But for now, most people taking psychotropic medications must deal with the side effects. Dr. Carley reassures Roberto that for many people, the side effects are less bothersome than the mental health symptoms. Often switching medication, changing the dosage, or adding on a second medication can counteract difficult side effects. There are a large variety of psychotropic medications available today that help to relieve the symptoms of mental health conditions. Medications aren't a cure, but they can be an important part of a person's overall recovery plan. While understanding how medications work in the body is important, the main issues many families struggle with are emotional. It's difficult watching a loved one begin to experience the symptoms of mental illness again after a period of recovery. The return of symptoms may be because the person has stopped treatment or when a dependable medication stops working. Families are often the best advocates to assist the person in getting things back on track. You need to know enough general information about medication options to do that job effectively. Keep asking questions and looking for answers in order to be supportive of your loved one as they make decisions about their treatment. In addition to asking questions, we need to share information. Our observations about our relatives' behavior patterns, life stressors, and life events can be invaluable to the treatment team. Roberto feels encouraged as he commits to helping his son find the solution that will work best for him. Just hearing that there is hope for recovery has inspired him to learn more.